Did you know that liver cancer is the 6th most common cancer in the world? It's also one of the leading causes of cancer-related deaths, with over 800,000 people dying from it every year. Liver cancer occurs when abnormal cells grow and divide uncontrollably in the liver, forming a tumor. In this video, we'll discuss liver cancer symptoms and signs so that you can catch it early and get proper treatment. Before we continue, we advise our viewers to consult with a doctor or a registered dietitian before making any major dietary changes. So, subscribe to the channel and let's get started. Liver cancer occurs when abnormal cells in the liver grow and divide rapidly, forming a tumor. The liver is a vital organ responsible for filtering blood, producing proteins, storing energy, and fighting infections. When cancerous cells form in the liver, they can interfere with these important functions and lead to serious health complications. Now, let's talk about some common liver cancer symptoms and signs that you shouldn't ignore. Number 1. Mysterious bruising or bleeding. Have you ever found yourself unexpectedly covered in strange bruises, almost like you become a piece of abstract art overnight? Or maybe even like touches leave lasting marks and you notice your gums bleeding for no reason while brushing your teeth. These puzzling signs of unexplained bruising and bleeding could possibly be related to liver cancer. This disease can disrupt the liver's job of making important proteins needed for blood to clot effectively. Like a fantastic little superhero living inside us, our liver plays a crucial part in creating clotting factors. These factors allow our blood to form the necessary clots that stop us from bleeding too much. However, when liver cancer enters the scene, it can mess with the liver's ability to create these life-saving proteins, leading to problems in the blood clotting process. A lot of studies and research have shown that people suffering from liver cancer might have to deal with unexplained bruises or bleeding. When the liver isn't working as it should, it affects the production of clotting factors like fibrinogen and prothrombin, which are super important for proper blood clot formation. As a result, even the smallest injuries can cause a lot of bleeding or bruising. You might have frequent nosebleeds, bleeding gums, or unexplained bruises on your body. It's key to remember though that while liver cancer can cause bruising and bleeding, other things can cause the same liver cancer symptoms. Certain medications, blood disorders, deficiencies, and other components related to clotting can also lead to abnormal bleeding. Number 2. Pain in the stomach. If you always feel a bothersome ache or discomfort in the top right part of your stomach, this could be a sign of liver cancer. Your liver is situated in the top right area of your belly, so any cancer developing there can lead to irritation and inflammation, and that's what's causing the discomfort or pain. The pain can either feel dull or a bit sharp and vary in how strong it feels. As the cancerous growth or tumor increases, your liver or nearby areas might start to swell. This can make your belly feel bloated or full, adding to your discomfort. This swelling might even create a noticeable lump. Keep in mind though that feeling pain in your belly can mean a lot of things, and liver cancer is just one possible cause. Various research and studies point to the link between abdominal pain and liver cancer. In fact, a study published in a medical journal called Gut showed that continuous belly pain is one of the common liver cancer symptoms among patients with primary liver cancer. They stressed how crucial it is to recognize this pain as a possible sign of liver cancer to ensure early diagnosis and appropriate treatment. The pain you could be feeling due to liver cancer can be because of various reasons, like the growth of the tumor, the stretching of the liver, or the involvement of surrounding tissues and structures. There might even be instances where the pain extends to other parts like your back or shoulder. Number 3. Liver size changes. Another liver cancer sign is that you're progressing through your day, you all of a sudden feel a strange phenomenon in your tummy. It's a noticeable bump or lump positioned right in the top right section of your belly. This unexpected finding leaves you curious, questioning what could be triggering this anomaly. This noticeable abnormality could be an indication of liver cancer, particularly as the illness advances, making the liver expand. Our liver is an amazingly versatile organ that's responsible for a plethora of bodily operations. However, when liver cancer comes into play, it disrupts these regular functions, leading to an increase in the organ size. As liver cancer progresses, the tumor grows, causing the liver to become bigger. This enlargement often shows up as a visible bump or lump on the upper right part of the tummy. You could spot this during a routine physical checkup with a healthcare expert or a self-check. But it's crucial to remember that just because there's a bump or lump in the stomach, it doesn't always mean it's liver cancer. Other conditions like benign liver tumours or cysts could also result in these stomach bumps. So, connecting with a healthcare expert for a total evaluation and a precise diagnosis becomes essential. Number 4. Changes in appetite and digestion. Your liver makes bile, a digestive juice that helps break down fats and soak up nutrients. But when cancer cells attack this crucial organ, they can mess with its role in digestion and nutrient intake. This can cause issues like losing your appetite, feeling like you've eaten enough much quicker, and changes in your digestive system, like feeling sick or even throwing up. A lot of research work and studies have made it clearer how liver cancer affects your appetite. One particular study that was published in the Journal of Pain and Symptom Management noted that people who have advanced liver cancer often lose their appetite and feel full much faster. This happens because the cancer affects the liver's ability to control appetite. Cancer in the liver can mess with how bile is produced and moved, affecting how food is broken down and nutrients are taken in. These problems can lead to a loss of desire to eat and feeling like you've eaten enough after only eating a little bit of food. Feeling sick or throwing up can also happen because of how the cancer affects the digestive process. So, if you find yourself just moving food around your plate, feeling like you've eaten enough quicker than usual, or always feeling sick or throwing up, then it could be due to liver cancer affecting your digestion process. Number 5. Body fatigue. When you have liver cancer, all your energy just vanishes into thin air, leaving you weary and exhausted. This could be a potential symptom of liver cancer, a condition that sometimes stealthily causes a constant state of tiredness and frailty. Your liver is the ultimate multitasker of your body, palming and managing countless essential functions all at once. But when cancerous cells set up camp in your liver, they can disrupt the organ's smooth running operation. The growth of a tumor can start affecting the liver's normal functions, impacting everything from the production of crucial proteins to metabolism and absorption of nutrients. This disruption might leave you feeling unnecessarily tired, weak, and missing your usual spark. Research has repeatedly drawn a link between liver cancer and excess fatigue. A study published in the scientific journal Cancer Medicine indicated that fatigue was among the most frequently reported liver cancer symptoms by individuals diagnosed with liver cancer. Now, fatigue can be a tricky symptom. It can be influenced by a multitude of factors, including the cancer itself and your body's reaction to it. Cancer cells can cause chaos in the liver, affecting its ability to perform its duties effectively. The liver is pivotal in metabolizing nutrients and creating substances that supply energy to your body. When this process is disturbed, it could perpetuate feelings of tiredness and weakness. So, if you find yourself stuck in a perpetual cycle of fatigue, don't just write it off as a lack of sleep or an overly active lifestyle. Number 6. Yellowing of the skin and eyes. One of the most prominent signs of liver cancer is yellowing of the skin and eyes, known as jaundice. This happens when the liver fails to effectively filter out bilirubin, a substance formed by the breakdown of red blood cells from the body. When there is an excess amount of bilirubin in the bloodstream, it can cause a yellow discoloration in the skin and eyes. This yellowing may be more pronounced in people with liver cancer due to damage or obstruction of the bile ducts. The buildup of bilirubin can also lead to other symptoms like dark urine and pale-colored stools. Suppose you notice a yellow tint to your skin or eyes. In that case, getting it checked out by a healthcare professional as soon as possible is important. While jaundice can be a symptom of various other conditions, it shouldn't be ignored when accompanied by other potential signs of liver cancer. Early detection and treatment are crucial in improving outcomes for individuals with liver cancer. So, if you experience any of these 6 symptoms, don't hesitate to seek medical advice and undergo proper screenings for early diagnosis and effective treatment. Now, if you like this video, hit the like button and share it with your friends. Don't forget to subscribe for more content like this, and thanks for watching.